Clap along if you feel like a room without a roof. Clap along.
Hi, everybody. Welcome back. And I hope everybody had a fantastic Thanksgiving and stayed safe. Our topic today is data. We are looking at really being successful for 2021 and setting up our year appropriately. We talked in our last session about what the key milestones were that we needed to achieve in Q1, and data acquisition is a key one that we need to hit. So in January, we're looking at reforecasting the budget. We're looking at the migration report, how many people went from single to family, family to single, and we're reallocating the budget for 2021. And right after that, we're going to our partner carriers, both on the medical and the pharmacy, and asking them for aggregated data from calendar year end 2020. So we want to look at the whole year, what was driving our cost. It's really hard to know what you're solving for if you don't know what the problem is. So we really need to understand what are the key cost drivers, whether they be large claimants, chronic illnesses like diabetes. And then, of course, in April and May, we as consultants would be going out to the marketplace to try to find solutions and designing programs to get our employees to participate in those programs, because that's the key element. In the summertime, we're asking your executive committee or your executive team for approval to roll forward with the new opportunities and the new programs that we're looking to put in place. And then in September and October, we're designing communications for the employees to let them know what the changes are. And that all starts with the data. So you can see that you really have to be working towards your renewal starting in January and February. We don't miss a beat. Every single month, there are key milestones that we need to hit and achieve in order to be correctly aligned with the timing for open enrollment if you want to implement new products and new opportunities in the marketplace to lower costs. So today we're going to talk a little bit about the data collection and the data elements that you need to be asking your carrier partners for. And then I have a guest appearance from Andrew Neary, our CEO, and he's going to actually show you what we do with the data. So he's going to do a demonstration of our strategic forecast tool, which is going to show you how we use that data for planning and really understanding what the opportunities are and what we should be going out into the marketplace in search of for solutions. So thanks, Andrew, for joining us. And I hope you enjoy our presentation today. Okay, we're going to get started. We're going to talk about the data acquisition and what data you should be asking your carriers for. So again, really planning the year and working the plan is the best way to be successful. And of course, the data acquisition is key in Q1. So the strategic planning piece is really based on understanding what happened with your data in 2020, looking at, was it high claimants? Was it chronic illnesses? Specifically, what was driving our costs so that we know what to go out to bid with in the competitive bidding process and the renewal management, really seeking out vendors that can hit and target those areas of concern and what's driving our cost to develop a strategy and a financial plan for 2022. So we're going to talk a little bit about the key milestones in the data. So of course, in the data acquisition, to build a sustainable strategy, we really need to have a deep dive into the data. We're looking at pharmacy and medical. We're looking at what clinical programs might we deploy to hit the key cost drivers that we're seeing in our data. Insight, action, what are the actionable items? Value-based plan designs, we talked about that many times, but if you have a big population of diabetics, putting incentives into the plan for them to participate in the diabetes management program is a key way to set yourself up for success. Looking at your plan dashboard, we want to look at aggregated data with pharmacy and medical, and we want to look at the top disease categories that are driving our cost. And if you look at the financial reports, and we look at them every single year, and I've done this for years, it proves out that 90% of your dollars are spent by 5 to 10% of your population. And you really want to call out what in those 5 to 10% is their category of disease and what solutions are there out in the marketplace to help us. On the pharmacy side, I always say that it's best to get out in front of them. So we have to look at the pharmacogenomics, the expensive drugs that are coming in 2021 and 2022. And fortunately, there are a lot of disease curing and life altering pharmacogenomics coming to the marketplace to cure and solve diseases that Americans have suffered for generations. So that's the good news. They are expensive. So on the employer side, we need to be looking at what's in the pipeline to make sure that we adequately plan for those. And those are some of the data elements that we'd be looking for. So I love this graphic because it kind of shows you that we're looking at the clinical data, we're looking at claims data, we're looking at utilization data, we're looking at disease categories, and then that helps us know what levers to pull. So is it value-based plan designs where we're going to incent people to participate in disease management programs? All kinds of opportunities this year. And there are a lot of new opportunities out in the marketplace that really get me excited. So when you talk about diabetes, there's a new company that I met a couple of weeks ago out in California that they're doing microbial gut analysis on diabetics to understand the microbe in their gut health and understanding how precision nutrition can help manage diabetes to the point where some of them are actually coming off of their medications, their chronic illness medications, because they feel so great and they've progressed in the precision nutrition has helped them, their bodies target the things that they need to be targeting in their food to help their glucose levels. So all kinds of new things out in the marketplace, new opportunities. It's an exciting time in medicine. We just need to clearly understand what those opportunities are out in the marketplace so that we can build a strategy. You have to look at your dashboard. We look at the dashboard in a rolling 36 months. So we want to look at calendar year utilization information for the last 3 years. And then we build these executive dashboards. So you can see at the bottom, we have a rolling 36 months so that if you look at data and you look at short periods of time, one high claimant can skew the whole piece of the analysis. So what you want to do is you want to look across a 36-month period to build out your strategy. And Andrew is going to show us how we do that with the strategic forecast tool. Chronic illnesses, you have to understand those buckets and understand what you're solving for, because if it's cancer, then you're going to want to look at narrow networks and centers of excellence. The centers like Sloan Kettering, City of Hope, the Cleveland Clinic, MD Anderson, who are doing new things and new techniques for cancer treatment, like immunotherapy, versus the old chemotherapy and radiation. So it's a win-win when you can develop a plan like that for your employees, because certainly we're making them well and they're getting a higher quality of care, and it's costing us less money because we're doing things right the first time. And looking at your plan versus the average is important to understand, are there opportunities with clinical programs that we might deploy, like asthma for children? They've been wildly successful in getting kids enrolled in asthma management programs, and they have lower ER visits and they have lower events, adverse events, by participating and understanding their triggers for the asthma events. So clinical programs like that not only help the employer by lowering the cost, but they help the employee because they feel better and their families. So this is a snapshot of what Andrew's going to cover for us today. He's going to walk us through our strategic forecast tool to really show you, when we get the data, here's what we do with it and here's how we use it to build a long-term strategy. So it's an exciting demo. I hope you hang in there with us and you can see the sample scenario that he's using. And we can't really talk enough about pharmacogenomics. So this is what's life-altering. These things are changing the way that we understand our body and our makeup. and the genetic analysis, the fact that these pharmaceuticals are actually going to be made precision medicine for an individual, so that we look at the amount that they're taking, that it's the right dosage that the person can metabolize based on their genetic makeup. So very exciting. We did a whole session on this, so I encourage you to watch that little presentation that we did with the videos embedded in it so that you can understand what a pharmacogenomic is. That is going to be front and center in 2021 and 2022. There are 40 to 50 pharmacogenomics in the pipeline. The genome treatments and the genome therapies are going to be extremely expensive. So you're going to want to make sure that you're aware of the pipeline and what it means. If you just think about understanding our genome, so a lot of employers are actually willing to pay for the genetic analysis for their members and their employees in a preventive manner. So really understanding, I did it in my family. So we took the genetic test and we found out whether I had the BRCA gene, which would predispose me for breast cancer, Alzheimer's. It did, a check edit of my genome and looked for specific markers to let me know what I'd be predispositioned for, so that if I identified something, I could get preventive treatment in advance to having that disease affect me. So it is kind of a new way of looking at preventive care, but a very successful one. And the cost has changed dramatically. As you can see, the cost in 2020 of the genetic testing is around $200. So very interesting new opportunity for employers to embrace. So before Andrew jumps into the demo, we want to talk a little bit about the data. The reason I get excited about this tool, and I think this tool is so fabulous in a strategic planning session, is it really allows the employer to determine what changes are going to be worthwhile from a financial perspective. No employer wants to make plan design changes that are disruptive to employees if it's not going to yield enough savings to make it worth it. So we don't want to make a change and have to communicate it and disrupt employees for, $15,000. But this tool allows you to determine the value of the plan design change and the financial impact to the plan, so that when you're running through these different opportunities, let's call them, on the plan design changes, this tool actually gives you a price tag associated with each of those changes. We talked about Q1, quarter one, being so important. And that's really when we use this tool in our strategy meeting with our clients. And we're looking at calendar year-end utilization information from the prior year. And we're really using this information to put into the model to build out not only next year's budget, but really looking at the next 5 years. And then, of course, every year we tweak that with what the prevailing marketplace is thinking about, plan design changes that we've, come to embrace due to the added improved quality to the member and the cost savings to the employer. And you'll see in the model that Andrew's going to go through in a minute, we break out employee cost in two ways. So not only do we look at the payroll deduction within the model of what they're, if it's 80-20, they're 20% of the total cost of benefits, but we also put into the model their out-of-pocket costs. So at the point when they're actually accessing benefits, the deductible and the coinsurance, we've assigned an actuarial value to that to put that into the model as well. So you can see the true cost to the employee versus employer. And again, that's helpful in your planning, especially if you're thinking about tweaking contributions for the year. So we'll let Andrew take it away and show us the tool. And I hope you enjoy his demo. Andrew?
All right, thank you, MB. So I'm just going to take a couple minutes and I'm going to walk you all through our strategic forecast model. What you hopefully see in front of you is 3 different gears, 3 different cogs. We have our data input, our analysis, and then our strategy. And we've done a sample here. We've called it Acme Incorporated for purposes of today. So what you see here is just to sort of tie the data input to the view analysis screen. We have our 1,000 employees here. The 17 million we just talked about a total gross, employer cost net of almost 15, the 2.157 in employee contributions, and then 2.8, almost 2.9 million. Now, what is this? This is the 15% on the PPO 90 plan. You might have asked yourself, well, what's the total value of that? So if I add up all the copays, deductibles, coinsurance that my employees are paying on an annual basis, it represents almost another $3 million. So they pay about 2.157 to have access to the plan. And then when they utilize the plan, they pick up about another 3 million. So we sometimes refer to as the 2.157 as a payroll tax, and the 2.8, almost 2 or $3 million as a consumption tax. All right. There's no trend yet going forward, so you can see all of the years going out, 2021 to 2025 are the same numbers. So we adjust by placing trend, right, or including trend into the analysis. So on the medical side, just really making numbers up here, maybe 6% for medical. Again, we can change that, as you can see, by years. Maybe RX is 8%, right, with the new gene therapies coming out. More drugs coming into the pipeline, slightly higher trend. We could trend out dental and vision as well. We do not have those loaded in the model. So we hit save here. You can now see, based on those trends, your total cost is going from 17 million, 2021 to 18 million, so on and so forth. By 2025, 23 million. Same enrollment, same designs, but just based on trend, we're going from 17 to 23 million. More importantly, over 5 years, Acme Incorporated is going to spend just over 100 million in total cost for medical and RX. We say, okay, that's unsustainable. So we're going to hit budget trend button up top. And then our clients will work with our clients, talk to them about what is sustainable. They might say an example like this: we'd love to be at, we'd love to be at flat. So we can type in an employer trend of 0. And if we're successful with that, we would also type in a employee trend or cost shift to the employees at the same amount, which would be 0. So we save that entry, right? And now we build the graph. So if we start at the bottom with the employer cost and click that button, the employee out of pocket. So we're building the total cost picture, the employee cost share, and then more importantly, the funding gap. So really the focus of today, the focus of the strategy is this funding gap. This gap is illustrating for us what is the difference. So what is the difference between that 6 and 8%, 6% medical trend, 8% RX trend? If we then said we want to hold that to 0, right? We want from an employer's perspective to be flat. What's the value of that differential? What do we need to cost shift, cost avoid, save for our employers to make this gap basically go away? Down below, you can see the value of that is 1.089 million. So for 2021, we need to carve or save, cost avoid, cost shift about $1 million. Going forward, 2022, 2.2 million, so on and so forth, to the tune of about 17, almost $18 million over a 5-year period to hold costs flat. Okay. So what we do, this is kind of where the fun begins. We work with our clients, work with our employers, real time, and we're going to come to that table, right, with a strategic forecast model. More importantly, with the data loaded. We have observations and considerations. We've looked at the data. We've mined the data from a financial and clinical perspective. We've benchmarked the information. We've run some of our proprietary tools, and we're ready to build out that strategy. So I'm just going to give you 2 quick examples here. Over to the left is our opportunity pyramid. So I can click on plan design as an example. Click plan design. I'll say medical, and maybe I want to change the deductibles. What pops up is my ability to adjust those deductibles. I see my plan down here, the PPO 90, the 80, the HDHP plan. Maybe I'll say for the PPO 90 up here, I'm going to change that for next year. You can see it as a 300, 600. Like what I'll do is we'll do a 400, 800. So I'll add $100, $200 to the family, and then the out of pocket. Maybe we want to go up from 2,000 to 2,500, and then 4,000 to 5,000. So add another 1,000. Okay. We know that change based on our actuarial models is worth 1.8%. We hit save. It's going to track that change because at the end of the day, we might have 30, 40, 50 different strategies. This is just one strategy, but it tells me what it is, right? It's plan design, it's a deductible, it's on the medical and RX, it's the PPO 90 plan, it's for next year. And then what we've changed it and the value of the savings. I have the ability going forward to maybe click this off or on. I could even change the years and edit this if we didn't want to make the plan design change the first year, we wanted to make it the second year, okay? Go back and view analysis, let's see what that did. So as you can see, this gap, right, closed a little bit, closed to the tune of about $233,000. So our old gap, funding gap was 1.089 million here. We saved 233,000 based on that change. We have 856,000 left to go. More importantly, due to the compounding that change over 5 years, that simple plan design change is worth 1.325 million, okay? Another example, funding method, really where we want to spend the vast majority of our time with our clients, with our employers, is not on the right side down here of the pyramid. This is truly just cost shifting. We're not saving anybody any money. We're shifting this to the employees. We want to spend time on the left side, the true cost reduction. So Marybeth, for many of her clients, self-funded clients, we have 2 prescription drug coalitions. So we spend a lot of time in the funding method with prescription drug. We want to evaluate our coalitions. We want to see whether we can keep it embedded with the medical, keep our employers where they are with their carved out PBM by utilizing the purchasing power, the leverage, the size of our coalitions in order to drive their price down. So true cost reduction as opposed to the cost shift. So in this example, we might want to say, well, the PPO 90, the 80, and the HDHP all have the same prescription drug vendor. For next year, we want to negotiate or carve that out to our coalition. We know that savings overall is worth 3.25% of the total cost, right? Probably more so 15 to 20% of the prescription drug costs will be reduced. We hit save. Again, it's going to track that change. We go back to view analysis, and you can see this funding gap in red almost fully closed just based on the deductible or the plan design change and the prescription drug change. So we have 267,000 left. We saved a total of 821,000. With those 2 changes, we're close to 5 million of the original 18 million reduction. This then becomes what we can do is PDF, this full file. Then we take this full file and we begin to work with you. We begin to work our consulting teams with your team on building out an actual physical document, right? A fluid document, right? It's dynamic. It's going to change, right? Year to year as the market changes. We're going to come back to the strategy, to the roadmap. We'll make any adjustments that are needed. We're also going to evaluate the strategies that we put into place. We'll come back and utilize the strategic forecast model again in that scenario. But this becomes the foundation, one of the proprietary tools to build out that multi-year strategy. We are currently in development of revamping this model, so more to come next year, but we've added life, we've added disability, we're adding diversity and inclusion benefits within the program, social determinants of health. We have much more coming to bring this model into the next generation. So thank you all, thank you MB, appreciate the time. And have a great day.